reach out to you.
Thank you. I got a mic for you right here, sir.
Oh, thank you very much. Hopefully I won't have to say anything.
Well, we always enjoy it when you say things.
Oh, no.
I'm really grateful that you're here today.
Yeah, is Mike here today?
He had to go home. He's sick.
Okay.
And so, what are you asking?
Oh, no, he just had some questions about these thank you very much. A couple of these ordinance, or a couple of these codes we got. And I don't even know what he's talking about. So, long plat versus preliminary plat stuff.
Thank you all.
Okay. And then... Hey, Kim.
Thank you. Did you ever find that?
No, sir. I tore apart my office in the upstairs. I found no other.
Anybody have any knowledge of sending one?
Things from Scott? Okay.
Unfortunately, we're either into it for a replacement or it's hiding in a drawer someplace that nobody remembers putting it.
What is it?
Okay, so we don't know if mine or the city's was.
Well, I believe the one
that's
I
old.
sent back was the city's because the serial number on the unit matched the serial number that Comcast provided us.
Okay.
They said they want this one.
Okay. All right. Well.
No,
All right. Thanks.
Hey, Dan. So one of the things that Shay was doing during the medical review was adding me to some sign things for Medicare, and found that the city of Montesano hasn't been in compliance with the setup.
I know.
So one of the
I mean,
things
I
we do, it actually is like all the council members are like board of trustees to that, and so we need all the council members to answer one question, and she has all the paperwork and everything, and any other stuff by city law, and do that.
Sure. What's the question?
It's basically have you ever been involved in Medicare fraud, things like that. So it's a yes or no question.
Do I need to bring the list with me or what?
No. And then it's a social security number, and she didn't want to have to go in and look for social security number. So.
Okay.
So last meeting, we passed resolution 978, it should have been 979.
It's scripted, you can just change it.
Yeah, Kim didn't know if you was going to make it. That thing would need to say.
I mean, we have language in the law that says we're allowed to correct scripters. That's a scripter.
Oh, that's true.
Don't worry about it.
That's true. Forgot about that.
Yeah, and I can remember it was something like that.
Yeah.
No.
Who do we have filling the void left by, right now? No one yet?
So Arnell was taking care of the three major issues that no one else but Arnell can.
Yep.
Doug is.
Is Tyler not here?
He is not.
Okay. Well, I can say, actually, I can.
So me not having lights.
You answered it in the way I intended it, not the way I asked it. It's like, obviously, no.
What? Well, because he needed to still show. Oh, I guess not. I don't know. Not sure.
Yeah. Her position.
Does that matter?
No. Sorry.
Okay, thank you. Thanks. You can't see me.
caption, they're going to on the big screen, then the closed captioning is going to be going in because I don't have a second screen.
You mean closed caption here? That's okay, because so far nobody's here. It's going to-
Fair enough.
But if she shows up, then we have to explain that. So will you remind me if she shows up and I'm not? But closed caption doesn't go away online.
No, absolutely not.
Okay. Good.
Okay, nice.
This is the part for something. I just I didn't do that.
I didn't do that.
I didn't send that.
Rumors.
I'm going to call the Montesano City Council meeting for September 14th to order. If you will come stand with me and join me in the flag salute. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Will the clerk please call roll call?
Councilman Wood?
Here.
Councilman Bryson? Here. Councilman Coe?
Here.
Councilman Christopher?
Here.
Councilman Trimble? Councilman Scarmica? Here. Councilman Charles?
Here.
Is there a motion?
Would move to excuse the absent council member.
There is a motion by Councilman Cope and a second by Councilman Bryson to excuse Councilman Trimble from this meeting. Is there any discussion? Hearing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries. We are at approval of bills. Does finance, is there a motion?
Second.
There is a motion by Councilman Bryson and a second by Councilwoman Cristobal. Would finance like to give a report?
Yeah, Finance Committee, consisting of myself, Councilwoman Cristobal met. We didn't have a finance person there, so we reviewed the bill for a total of $245,462.13. The largest of which was an annual payment for a paint construction loan. I believe that's the one off Mancap Avenue. And the total on that is an annual payment of $162,423.36 principal, $14,618 in interest.
Does anyone have any questions of finance? Is there any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries. Bills are approved as audited. We are at approval of minutes. Is there a motion?
I move to approve the minutes from the last meeting.
Is there a second?
Second.
There is a motion by Councilman Scaramucca and a second by Councilwoman Cristobal. Is there any discussion or corrections? Hearing none, all those in favor, please say aye.
Aye.
Any opposed? Minutes have been approved as written. We are at the first opportunity for public comment. If there's anyone that would like to make public comment at this time, please feel free to come up to the stand. Okay, then there will be another opportunity later in the meeting if you would like to make some. So we are at the point of doing a presentation on our agenda. This is from Harbor Regional Health, which is the Grace Harbor Community Hospital. I'm going to introduce a figure well known to all of you, Chris Thomas, Commissioner Chris Thomas, and I'll let you introduce everyone else.
Good evening. Thank the council and the mayor for having us, giving us your time. Over over the last year, I've had several community members say they'd like to hear more from the hospital. They'd like, more information. And as your commissioner, I was elected by this area to represent you in the hospital. Well, I'd like to do that now. So I'm here with another commissioner and with some hospital administrators and doctors to give you kind of an overview of the hospital and a community update. And let's see if I can start the PowerPoint.
Before we start, I wanted to just let you all know for the council, the closed captioning will happen online, but since the presentation is happening here, we won't see it, but it is still happening online. Since there's no one present that requested that, that should be, I think, perfectly fine.
Chris, so you're going to have to eat that mic in order to make
Yeah.
sure it's picking up.
Okay, is this better?
Yes.
Okay.
Thank you.
Okay, well, I'm the commissioner for District 1, which is the public hospital district has 7 commissioners. 2 are at large and 5 represent specific areas. And I represent District 1, which includes Montesano here. It includes Brady. It goes all the way to like Central Park and goes all the way down to Arctic. And what we do on the board is we bring the community needs and values and make sure they're communicated. We do the strategic planning, and we let the doctors and administrators run the hospital. These are the current commissioners. There's myself. There's Michael Bruce from District 2. He's the chair. There's Lynn Castaneda, District 3 on the coast. Andy Bakar, Hoquiam area. Becky Walsh, Aberdeen. David Quigg, which is the another at-large commissioner, and Scott Dilley, who's from our community too, is also an additional commissioner. Here's a map of District 1, and kind of gives you the area. It goes all the way to the top of the county, kind of cuts straight through to the bottom of it. And I won't take too much of your time on my part, so I'll hand it over to Commissioner Dilley, who's one of our at-large commissioners.
Thank you, Chris. No, it's a pleasure to be here. I believe I know many of you. I've lived in the Montesano area for about 20 years. I actually live out in Brady. My kids have gone and still continue to go to the Montesano School District. So it's great to be here tonight. As Chris said, I'm one of the at-large commissioners on the hospital board. And of course that encompasses the entirety of Grays Harbor Public Hospital District 2. And then the other at-large commissioner is David Quigg. He's not able to be here tonight with us, but he too is representing the district as a whole. So we're here. I think I speak also for Chris when I say this. If there are any issues, concerns, ideas, partnerships, whatever, we're all ears. We're here to listen and also to take actions when need be. So we'd love to be responsive to the needs of Montesano and to the needs of other communities in our district. So again, it's a pleasure to be here, and I will pass the microphone over to Tom Jensen, our CEO.
Thank you, Scott. Appreciate it. Thank you for having us. I really appreciate having the opportunity to talk just a little bit about the hospital. As some of you may know, we recently changed the name, and there's a lot of controversy about that. And really, what we tried to do is explain to the community how much, other than just a hospital, Harbor Regional Health is. So let's kind of give you an idea. There you go. So as you can see, it's got 28 specialty services, not just in the hospital. In Montesano, we have a clinic, and of course, also in Hoquiam. And then we have a PT clinic out in Westport. But it just gives you an idea of some of the services the organization provides. We are a level 3 trauma center. And what that means is the ED has surgeons on call 24/7. What I would call this group of disciplines really is what community hospitals are all about. The one unique part that you don't see very often in a community hospital is cardiology services. And I'll have Dr. Wong talk a little bit about that as we move through the program. Now I'd like to introduce Dr. Anne Marie Wong, who is my Chief Medical Officer.
Hello, thanks for having us. Just a little background on myself. I am an internal medicine physician. I'm board certified in internal medicine and hospice and palliative care. I still actually practice 1 day a week in my internal medicine practice. When I became chief medical officer, definitely entails a lot of talking to many different people and reaching out and finding out what people need or what people want. And by doing that and a lot of discussions among the administrative team, prompt care is definitely one of the things that came up very frequently for our community as well as many of our providers. And we have been very fortunate to have prompt care now open for a little over a year. Rachel Fott is up there on the slide. She's a nurse practitioner, and she's there 4 days a week. And we have Ron Oman, also another nurse practitioner, who's there 1 day a week. So we are providing same-day appointments 5 days a week, Monday through Friday. And we're hopeful that we will be able to expand the service and offer care 7 days a week. I think that this has worked out really well with COVID, being that we need to keep people separated, and especially with respiratory care. So we've been able to transition our prompt care to allow same-day appointments for sort of the sprains, strains, those types of injuries, and maybe respiratory care at another time so that we can be sure that patients aren't, say, cross-contaminating each other and keeping everyone safe. So that's been a great thing for us also to try to keep respiratory patients out of our regular clinics so that our other patients who are coming in for chronic health checkups are not being exposed to respiratory illness. So that was a very fortunate thing for us to have prompt care open this last year. We also brought on cardiology services, and we have several cardiologists that provide the care for us. They are available 24/7, 365 days a year. They are not only are in the hospital available to do emergency catheterizations for things like an acute myocardial infarct or a heart attack, but they also have clinic hours, so they can offer evaluation assessments of a multitude of cardiac problems. And I think a lot of them are listed up there, many of the different services, including EKGs, echocardiograms, Holter monitor, etc. And I'll introduce Elizabeth Shimperly.
Good evening. My name is Elizabeth Chimperly. I am the executive director of the medical group. So I oversee our primary care and specialty care services in our rural health clinics that are one here in Montesano, Hoquiam, and in Aberdeen. And then our specialty clinics include orthopedics, general surgery, urology, and cardiology services, which are all there in Aberdeen. Many people don't know, but we do have a clinic, a family medicine clinic here in Montesano. Most recently, we added Dr. Stafford to our clinic here. So she started with us in May. So we have Dr. Stafford and our nurse practitioners, Mindy, Kirby, and Jacqueline, who are providing family medicine services here in Montesano. So for family medicine services, we see children and adults. We do well child checks. We could do sports physicals, women's health exams, Medicare wellness exams, chronic condition care, and vaccinations for children. Also seeing patients to do specialty referrals locally and outside of the community if necessary. But we are excited to have our providers here and are continually looking to grow in primary care and in adding specialty care services to the community as they need. Any questions?
Does anyone have any questions?
I have one question.
Councilman Scaramucca, just for the,
Prompt Care, is that East Campus?
Prompt Care is located currently on East Campus, yes. Yep, and it is essentially by appointment, so same day appointment. So you could call in and hopefully get an appointment on the same day, depending on how busy we are. We are significantly busy with respiratory patients, and they do see pediatrics, so this time of year tends to get a little bit busier with our pediatric patients. So the goal is that we can get patients in for same-day appointments.
does anyone else have any questions? I'm not sure if I'm supposed to ask you or any of you, but has the hospital been impacted based on the COVID? I mean, we read about it, but I guess since you guys are here, I thought you could share that with the council.
Yeah, well, the Dr. Wong starts now.
I was going to say, absolutely impacted. So, probably all aware of all the different, I guess, surges we've had, and we're in what, fifth wave now, which has surpassed every other wave in the state, and we are seeing it in the hospital as well. So prior to this wave, I would say on average, we may have seen maybe 3 to 5 patients hospitalized with a COVID illness. This past week, I think we hit a record of 15 one day. And then it's been pretty steady around 10, I believe is the average. So we've been impacted by the illness. Now, these patients are admitted. Many of them stay for much longer than you typically think about for respiratory illness. You know, when patients come in and they've got chronic bronchitis, exacerbation of their COPD or pneumonia, I would say the average length of stay is probably 3 to 5 days. For a COVID infection patient, especially our very ill ones, we're seeing people stay for at least, as much as 2 weeks. So it's rare that we see someone come in, they're sick enough to come in that they're only going to be in the hospital for 3 days. So that's impacting our ability to care for other patients. So in fact, it's a day-to-day process right now that we are looking at how many patients we have in-house, how many patients are in the emergency room waiting for a bed, how many people need to have surgery, and though we haven't gotten to the point that we are canceling all elective procedures like we had to at the very beginning of the pandemic, we are definitely looking at every day, like which patients can we actually do their surgery, because if they need a bed in the hospital and we don't have one, it's probably not appropriate. Probably not appropriate to put somebody who could maybe put off surgery to put them in that bed when we have somebody in the emergency room that's waiting.
So I guess my follow-up question is, obviously, well, I shouldn't say obviously, but I assume that has impacted both finances as well as staffing, just because that's what we read.
Well, the infection itself affects staffing in the fact that staff also are getting sick. Mm-hmm. So when they're sick, it's not like they're just missing 3 days of work either. And the required isolation or quarantine is anywhere from 10 to 14 days. So even if, say, I got sick and I had very minimal symptoms, I would still be required to stay out of work for 10 to 14 days afterwards. So that does impact our staffing in the hospital. So not only are we caring for the sick, but then if our staff is getting sick, then that impacts our staffing.
So my last question, I think that Councilman Cope has a question, but I'm not sure, but is that, so as a follow-up to all of that and everything you guys have discussed, is there something that you would ask that the city of Montesano helps you do, either on the level of the COVID mandates that are being handed down or on any other aspect of which you guys are responsible for engaging?
As a physician, what I would say is that we need to continue to do all the measures to mitigate this infection. So if it's everything. It's not just one thing. Vaccines are not going to fix everything. So it's get a vaccine, wear a mask, wash your hands, social distance, Don't spend a lot of time with people if you don't know if they are not sick. If you're going to go on a trip and you know that you have a risk, then maybe you need to isolate from other people until you know that you're not sick. The problem with the virus, of course, is that even if you're vaccinated or unvaccinated, there is a period of time before you actually show symptoms of illness that you have the virus and you can spread it. And with this Delta variant, because it is infecting 7 times as many people as the wild type did, we're talking about a lot of people that you could possibly expose. So if you can limit your exposure to spread the disease, that's probably the biggest thing that can help, because the fewer people that we have arriving in our emergency room with severe COVID illness is going to help the rest of the community.
Councilman Cope, I'm sorry, Mr. Jensen, do you have anything you want to add?
I was just going to say that and open lines of communication. If there's something that the city needs, whether it be vaccines or testing or anything like that, you can always call the hospital, and we'll either work with the county, the health department, because that's what we've been doing the whole time. Though I know sometimes people can feel isolated when they're not within that the public health department's circle, if you will. But there's a lot of education. Dr. Boucher's doing a wonderful job. He works with Dr. Wong on a daily basis, and they have conversations with stuff. So if we can be a resource, we truly want to be. Yeah.
Councilman Cope.
So you mentioned Grays Harbor as a level 3 trauma center. Emergent responses are taken there as the kind of the first stop after they're picked up by paramedics. Can you talk about how how COVID has impacted the ability of that emergency room to serve those patients when they are en route? As we understand it, it's what we read again, ambulances are being told to divert to other trauma centers and other medical providers rather than bring them into community.
Yeah, I would say Washington State's a unique state because they actually have a transfer center. So what they do is they monitor all the hospitals in the state of Washington, and so if we can't take them, then we usually try to find another organization or facility that can take them. So that's really unique to a lot of states. A lot of states just don't help with the transfers, and this one does. As far as the staffing shortages everywhere, I mean, that's probably the scariest piece. It's one thing when one organization has a staffing problem, you can transfer patients. It's when the state has a staffing problem, it becomes a real issue. I think the unique part, and I don't know if everybody listens to the news or is into healthcare as much as I am, but I mean, if you look at Idaho, they went into crisis mode, and to the point where they're having to ship patients out of their state just to get taken care of. And that's truly the scariest, especially when an organization like Kootenai, as large as they are, can't take any more patients because they don't have the staff. So yeah, it's tough.
I was going to say one more thing that I thought of that you could help. Is that healthcare workers are exhausted. This has been going on for over a year. It is emotionally and physically draining to take care of these patients. And at the very beginning of the pandemic, everyone was saying, high five, you're so great, thank you for all your service, thank you for all your work, thank you for putting your life on the line to help other people and to save lives. And I think that they need that still. And so I guess what I'm saying is, if you know a healthcare worker, give them a high five. If they're in your bubble, give them a hug. Tell them you appreciate them. I think it will go a long way. And that will really help us too. I think there are a lot of people that are thinking about leaving healthcare because they're exhausted, they're burnt out. And so any way that we can kind of keep people going, and if the community supports them, that definitely helps.
And I would say the same for EMS. You know, they're in the same boat. They're seeing it every day, and they're taking chances every day they go in and see a COVID patient, not knowing whether they have COVID or not. So hats off to all of EMS.
Councilman Wood, did you have a question?
Yeah, first question is there an endocrinologist anywhere in the HRH system?
No, not at this time.
And then just the second thing, so what I was told, Tom, was at the beginning of this COVID situation that you had the foresight to go out and get a freezer.
Well, I know that sounds crazy, doesn't it?
Hold
A
on.
freezer.
If it's not true, don't tell me. But I was told that your foresight in getting that freezer big enough in order to store the Pfizer vaccines was key to us being able to get enough for the county and do that mass vaccination. So I want to acknowledge that and thank you for that foresight. And if it's not true, then this is not the place to dispel the story.
Sometimes it's better to be lucky, if you know what I mean, sir. Sometimes it's better to be lucky. So, thank you. Thank all of you for your time, and like I said, anything that we can do, just reach out.
Thank you. Anyone else have any questions before they leave? We appreciate you all coming. Thank you, Commissioner Thomas and everyone else and doctors. It's always lovely to have you guys here. Okay, we are going to...
I don't know.
I've lost a piece of my... No, I'm looking for something else. So we're going to go ahead and move to... thank you. We're going to move to committee reports. I'm in a report for Councilman Trimble, but is there any other committees that met while... go ahead, Councilman.
Forestry Committee met this evening at 6 o'clock. Councilman Carl, Councilman Bryson, myself, and Forester Heiner were in attendance. We reviewed the pre-commercial thinning action item that will be on the agenda for action today. We are recommending passage. We'll get into that more when it comes up for consideration. We also received a report on the 2022 budget from Mr. Heiner. Looks like the harvest for the coming year is set, a little smaller than would normally be, but harvest, site prep, tree planting, and another round of pre-commercial thinning are all some of the high points on the budget that are planned for 2022. Firewood cutting with rain this weekend. The forest will be open for firewood cutting here in the not too distant future. Kind of looking back on how it weathered the hot weather, unseasonably hot weather that we had these last few months. They only had to close the forest once. Lauren seemed to think that things went very well this summer. And not reported during the committee meeting, but worth noting, this will be the last few days for Alana Cross and Anthony Johnson, who were the two summer interns that were working with Lauren in the city of Montesano Forest. Alana was actually back for her second summer with the city, so we appreciate her coming back. We appreciate her and Anthony both working so hard for the city, and wish them the best of luck as they head back to school.
Thank you. Did any other committees meet?
Public Works. Public Works met on Wednesday, September 1st. We had two topics. We actually had a short meeting compared to some of our meetings. The first is we completed section 3 of the water system plan update. It's complete. It's got all graphs and charts are installed. We'll move on to section 4, I believe, in our next meeting. I believe we have a total of 9 sections before it's completed. It will be completed before the end of the year, and this isn't anything we're doing just because we have nothing better to do. It's required by the Department of Health, something we have to complete. And the second, Mike showed us this draft of the water system design standards. This is something that always existed but was never really tidied up like it is now. What this would be important to is any contractor that came into the city and installed or repaired any city utilities. It's really clear our expectations, and half of it is filled with mostly detailed prints of how we want things done. There's been a little bit of trouble in the past with some contractors, but this should clear things up. That's it.
Okay. Anything else by any other committees? Does anyone have any questions of either Forest or Public Works? All right, so Councilman Trimble did a lot of work in between, and I asked if I can report it up, and this is regarding the generator funds, the ARP funds. It looks good. It looks actually very good. We got confirmation from, I can't remember now. I think it was MRSC, which identified that we could use those funds so we take the state funds that we receive through for the wastewater treatment and subtract it out, so we would be able to have more flexibility in the fund usage. We confirmed with Mike Olden that there was no federal monies attached to that grant, That was kind of the defining line. So, and Arnell Blancas also said he thinks that based on the response that we received, that it looks very good. So the next step of this that he was inquiring on, that we did not have an answer for tonight, is to find out where, so when we have a $2.1 million difference between 2019 and 2020 on the final ending balance of all budgets. So the question becomes, do we have to put the $1.1 million into a specific fund entity? We don't think so. We're going to get that, he had already asked that question and we were just waiting for a response. But we want to make sure that there's no ties as to how we would put it, because then what we would want to suggest to you, and this is really finance to figure out, is to take a portion of the money and put it into different sections as allowed, and then spend the rest as, which should allow for us to have the flexibility to be able to do probably any project that is coming up. So that's, I think, fairly exceptional news. And part of that, the ARP money, and today was a perfect example of a problem that we've been kicking down the line, which I think is, at least to me, as important as the generator, and that is we need to fix the council chamber. This example behind me is one of the problems. We need to start investing the money to have a chamber that works all the time, whether it is for closed captioning, whether we have presentations. We need another screen to be able to do multiple things, and that's, we haven't spent, I mean, I think we spent $20,000 on this room, and the reality is we need to commit to moving forward, whether it's this room, downstairs, whatever infrastructures that is necessary for either to be able to do it. One of the things you're seeing here is delay. Part of that reasoning is we had to choose between, when we did CART is going to be in your budget, it's around $16,000 a year, because we have a minimum buy every single meeting. And so, and then we need to also allow for labor to deal with that. But the part of that issue with CART, and we're still looking at different options if we can figure out a different option, is that we can have accuracy, but we have a 30-second delay, or roughly 30-second, whatever the delay is. And or we can have live streaming, I mean, like 2 to 5 seconds, but the accuracy is down to like 85%. That is a choice of two potential negatives. And so we haven't completely given up the fight as in trying to find a better option, but it is balanced between cost and access. And so I don't have obviously a lot of pieces, but having two screens, having easier access to certain things would be part of that, having better broadband so it's easy for people to stream anything while they're in the meeting would be important. So I'm going to put that on the agenda next meeting, and I'm going to ask for you guys to consider action fairly quickly, because I would like to move forward with, if we find out where this money goes, I guess but I think that it would apply under either option, either stream of access of income.
Just want to make sure I understand this for when people ask us about it,
Okay.
that the MRSC ruling states that as long as state money is what we're talking about, not federal money, it will make up for revenue or reimbursement lost during COVID, providing more budget flexibility for projects like this that you just discussed and the generator. So we have,
Right.
well, it doesn't cover the cost, there's more flexibility within the budget to handle those things.
Right, and once we figure out where we can put the money in the budget, if we can just put it wherever we want to, which as you all know, the biggest quandary with this was we couldn't look at one line item and say, hey, we have a massive shortfall here, can we put it here? If we can put it where we want, then we have tremendous flexibility. If we have more rules than that, which I suspect we will, then it makes it a little tighter. But it doesn't matter. It would still free up pieces in a way that we didn't have just 2 weeks ago. And I know he's waiting on the answer for that, but he had a really good, he had a good response time, and so I think that we should know fairly shortly. Any questions at all?
So when do you expect we will go to bid on the generator?
So this is put on the agenda as an update. Finance Committee and the motion that was made is going to report by next council meeting, and I expect them to either give us an answer as to we can take this out of ARP money or a different option for funding. So, any questions beyond that?
That's correct, that's the plan. Get this question answered so we can clarify, finding out that there's not federal funds involved was a key component to the answer. Make it positive, so by next meeting we should have that next plan.
Okay.
But I just want to be very clear, the access, if you guys have chosen to broadcast and that is a goal for all of us into the future, and we need to have a better system than we have right now. And so I know since we're piecemeal funding on the generator, I think there is no dispute that broadcast access and good technology to support that is equally important. So I will put that on the agenda as well and ask Finance Committee to figure out how to pay for it. Moving on, we are going to go in executive session. I suspect this will take us 15 minutes. It is now 36 after? 7:35. 15 minutes.
Yeah, a little bit too. Oh, really? Yeah, on Saturday. So, yeah, I talked to him the other day. He was checking it, seeing if he needs to fix his science and the 80s, and that was good. At the school campus. I seen him walking around. Okay, he's showing his pressure. Yep.
back at 7:46 with no action. And we're moving on to old business. There is none. We're moving on to new business. The first item is budget timeline. All committees should be reviewing the budget hopefully over the next couple of weeks. Does anyone have any questions about the budget? Timeline, sorry. Okay, so hopefully by the first meeting in October, we'll be bringing this to full council to deliberate. I'm assuming that most of you have seen your sections of the budgets and that you have reviewed them, but if you have concerns, please let me know. Moving on to award of pre-thinning contract.
Madam Mayor, would move that the council authorize the mayor to sign an agreement with Curtis Hill Forestry LLC for the pre-commercial thinning of 158 acres per the MPCT 2021 bid prospectus.
Second.
There is a motion by Councilman Cope and a second by Councilman Bryson to award the pre-thinning contract as indicated. Is there any discussion?
Just to update, the budget for this was $30,000. We did only receive one bid on it, but it is on a well-known and well-respected forestry company that the city has worked with, and it came in significantly below the budgeted amount, and I would urge support.
Thank you. Anyone else? All those in favor, please say aye.
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 Any opposed? Motion carries. We're now at body cameras and car camera contract. It's for introduction. Chief?
Thank you, Mayor and Council. I believe in your packet you have a quote from Bright, and it's for GTAC body camera and in-car camera solution. I apologize. My intention is not to. My intention was tonight to come and ask for the council, for the mayor to sign a contract, but it's not that easy. And I say that because this company doesn't actually. My plan was to pay for it. It's a 5-year package and pay for it each year, which would be about $19,000. But for a grand total of, I apologize, I believe it was, in the end, it would be $97,000. The reason I say it's not that easy is that would be it's a separate contract, because we'd have to do the financing through a separate company. This Bright company doesn't actually do their own financing. So my question to the council is, we have 3 options to pay for this project if the council says to move forward. One is to pay the entire $88,000 up front. We buy it all out. We don't pay year to year or anything like that. The second is to pay for the upfront cost, which is $49,000 this year. And then each year after that for the next 5 years, it'd be $9,000 and some change. Or we finance it for a total of $88,000 or total of $97,000, and it's $19,778 per year for the next 5 years. What I will say is the state of Washington did give the city of Montesano $16,000. So this first year, in any way we did it, there was $16,000, and it was for unfunded mandates that went along with the new legislation. So that's what I have for the council, and I guess
I would just add to that we, the chief and I talked about the body camera versus the car camera. There is an increased cost for the car camera, but I believe, and I believe he believes, that they're both necessary. The body camera has obviously a certain visibility because they're facing in whatever direction the officer is, and the car camera will have also a wider.
Yes, there's several features of the in-car camera. We have an in-car camera that faces, of course, out the windshield that gets from pillar to pillar. It also has a camera that faces into the rear compartment where we would put anybody if they're in custody. I think under transparency, the way of the state and the vote of the people, transparency is one of the biggest things that they're asking for. By no means do I feel that the city of Montesano or the Montesano Police Department isn't transparent in anything we do, but I think this just brings us into the year 2030, really, is what it comes. It also helps lock in the mandate, or one of the legislative mandates, that we audio and videotape anybody who we're interviewing reference a felony. We're not always able to bring them back to the station to do that. And even at that, right now we're working on the interview room at the station. We've never had an actual solid interview room at the station. We've used the middle conference room as our interview room. But it's now mandated that we do audio and videotape anybody. So we're working on that. We're hoping to have that completed here at the end of this month or the first part of next month. So, and again, in the state's great wisdom, they provided $16,000. It was basically, I think when I talked to Mr. Blankus, it was like $4 per head of everybody who lives in Montesano, right? So that's where we get the $16,000. So anyway, that's my thing. If the council, whatever way the council would like to move forward on this, now I don't know if this actually falls into the ARP money as well, the way we're moving forward. I don't necessarily know if we need to make that decision right now. One of the reasons that I do want to, that I talked to the mayor and wanted to bring it to the council now is that there is an implementation phase. Of course, we have to order the stuff. They have to come in. We have to get all of our cars set up and outfitted and so on and so forth. And so there is a process to it, and we need to be up and running by January 1. So that's when the new legislation comes into play as far as the interview process.
Thank you.
That's what I have.
I have a quick question.
Yes.
Yep. If you clarify the options that you presented.
Yes.
The second option was 49,000 upfront and then 9,000 per year.
Yeah, it's
how much? I'm just wondering what amount of finance charges would be included. Do you have that?
yeah, 5.75.
Okay.
And so basically, the amount we'll be financing will be $88,000, $88,040.82. I apologize, I can't see. 5 annual payments, and it would be $19,778.19 at a finance rate of 5.75. The number 2 option was we paid for the hardware and the warranty for the first year and unlimited cloud storage, which is $49,127.54, and then ongoing after that would be $9,728.32. So one way or another, we were paying for it. And initially, I apologize to the council. I thought it was as easy as signing this contract for $88,000, and the company would say, hey, we can do it in 5 years. And then when he sent me this and said, oh yeah, this is the company that we use for the financing, I want to make sure that the council is aware of that and that we had all 3 options available. So I'm not big. I mean, the $19,000 for 5 years seems like a good way to go, but in all reality, it's another $9,000 to be honest with you. And I know we financed things in the past, but
I'm more of the mindset if we can pay for it, maintain those services.
yes, and I agree with you.
9,000 we can spend on other needs.
And I agree with you, and that's why I asked you to give me all 3 options. And then that's the other thing, depending on if it does fit the ARP funds, would we be able to use some of that money to get this paid for? We'd be done for 5 years. And also, if you look at the outline of the contract, this is for 2 sets of body cams. What they do is the body cam is something that the officer wears. We get a body cam, all the hardware and all that stuff, and then in year 3 we get another one. Because basically what they say is that after about 2.5, 3 years, those things start wearing out. And so, so they give it, there's a second one. So it's basically 2 body cams in the 5-year, but the in-car cams are solid. They're not being bounced around, moved around, getting wet and things like that. So those are just a one-time deal. So just kind of an idea on that.
Chief, is there any chance that the legislature will be approached with the possibility of coming up with any funding to assist with this in coming sessions?
Well, I think there's always a possibility, but I believe that's what $16,000 is for. I believe that $16,000 that we got from the state was for their new legislative mandate, and that's what that was for. However, I believe it wasn't for body cams, it wasn't for an interview room, it was, hey, these are the mandates, the legislative mandates that we're doing, and this is the funds that we're going to give you to help you do that.
Well, I think you would agree that $16,000 out of $80,000 total is a pretty paltry amount when you look at that.
It is. And
considering the other requirements that you're also
when
being
you look
forced to
at,
comply with.
the sheriff's department, they're looking at $1.2 million or $800,000 for body cams and in-car cams. And so, being a small agency, it's still a high price on us. And we're also dealing with the cloud storage. That's one of the big things. I also researched with them about us buying an actual server and can we store this on ourselves. And I know that we have Sean, but I think that we're taxing Sean as it is, and I think it's going to be having the cloud service with them is the best way to go. So I really try to do my homework and make sure. And we went through 4 different companies. I got quotes for 4 different companies. We have GTAC computers. It's one of the reasons why I look at GTAC. And I know it says Bright on it, but it's GTAC equipment. And we also, the other company, there's 2 companies that finally came down to. It was Motorola, and Motorola is also our partner with Spillman, which was a selling point. But I'm actually not sold on Spillman 100%. And they've had a lot of issues along the way, and Motorola bought out Spillman, and they bought out the body cam company, and so they're merging a lot, and they're doing it really fast. So I'm concerned about the headaches that go along with that.
Well, I'm concerned that the legislature thinks that $16,000 is enough to cover the mandates that they've put on departments. So I would hope that, having Sheriff Scott so well positioned and organizations that were able to lobby the legislature, that's something that we brought to their attention.
Well, and if you remember, when I came to you the first time and talked about the body cam and the ARP funds, I know Mason County, they initially said, it was on the president's website, we're going to use ARP funds, and that was getting spread around through a lot of agencies. I just talked to Grace Harbor County this week and said, what are you guys doing? And they said, well, we're trying to get a ruling on the ARP funds. And so I said, what do you do if we don't get it? And they said, we're not sure.
Ruling on ARP funds seems to be a popular.
Yeah, so,
Chief, if we were to proceed with financing and then had the cash available, could we pay it off without penalty to avoid all the finance charges?
that's a great question. I don't know that offhand. I don't know why we wouldn't, but
I don't know.
yeah, I could ask that question. I could find that answer out very easily. And in the end result, I guess, yeah, I can find that answer for you. I can find that.
I don't know if there's a prepaid. We haven't seen the actual.
The contract, right.
Right.
And that's why I say I bring it, because there would be a separate contract that we would fill out for the finance.
Given the timing, do you need this tonight?
I would hold that for tonight because I would really like to know the answer of whether or not this would qualify for ARP money. And if it doesn't, then I would like to know which budget it's coming out of, because it's coming out of his budget. And so we need to make sure we're taking it out of somewhere.
But we have to do it.
What I would
Under
say
the law.
is it's
Under
not,
which one?
It's not imperative that we do it tonight. I want to bring it to the council. I want to get it out here for introduction and know the council where we're at and what it costs.
What's the drop dead date for we have to do this? It's June.
Well, I need
January.
January 1st.
But I expect, I'm hoping that this will be for action next meeting, which is why this is being introduced today. And so hopefully we'll have the contract and everything else in order, and then you guys can approve it and we'll be done.
Yeah, and I need to have the ability to audio and videotape interviews by January 1.
January 1, okay.
So I mean, we got 3 months. And then when I talked to the company, it sounds like the implementation is probably about 6 to 8 weeks out. So that's why I'm trying to get it going.
Right,
So we're
okay.
in December sometime when we're starting to roll this thing out and get the bugs out before we actually get to January 1.
Right, got it. Yeah.
Any questions? So this would also need to go to finance to explore ARP as to whether or not this is an option, because obviously it would be better if we're not doing the financing piece of it, and I don't know whether or not that is viable. I think it is, but I'm not sure. So
Thank you, Mayor and Council.
thank you.
Thanks.
Next is proposal for repayment of overdue bills, introduction, discussion, and committee. This is really just a status update, and for you guys to know that finance gets to review this as well. Councilman Trimble has been working on putting together, okay, so as of end of September, all the deferral as to the overdue water bills will be up, and people will need to pay their bills. Some people have thousands of dollars of bills owed. And I think the highest was based on a leak is up to $10,000 or over $10,000 at this point. And so that being said, it did not seem reasonable in my perspective to turn off their water the following week when they failed to pay that bill. And so we have, what I had suggested and what we had worked out was to do a 12-month repayment plan and at zero interest, and to have pay the current bill, pay 1/12 of the bill with 0% interest to the city, and that would be sufficient to maintain whatever whatever account they had. That being said, Councilman Trimble also came up with some other language from different cities, and so we hope to have something in place by next meeting. And if you have any input on any other options, I was thinking also that as part of the next billing, we would put in something in the newsletter saying that there are options for utility, access to utility, not reimbursement, but help, assistance, which they can get through, that has been given to CAP, and they could apply for to pay off a portion of that bill as well. And so we might actually put that on the bill itself instead of or maybe to those specific people that have late bills, to deal with that. Any questions? Or so I'm giving I should say that Councilman Trimble has been working on this, but Finance Committee should probably review this just as before we get into putting it on the agenda to clarify anything that there is anything. Does anyone have any questions about this or any other suggestions?
No, I know that we had discussed the need for customers that were impacted by COVID to be kind of first in line for assistance programs, but I do know that in the electric utilities, and it goes for municipal utilities as well, that they are being urged by the governor's office to make sure that payment plans are in place once the moratorium comes to an end at the end of September. So I think that this is a good first step to have that in place, ready to go beginning October 1.
If any, go ahead.
And just with the no interest issue, I think that might be a little problematic.
I know.
So I need to talk to somebody before that attempts to get finalized, because I don't think we can charge zero interest.
So if anybody has any suggestions, or if you've seen any other options available to the city, what my goal is to not add an additional burden to those residents, regardless of the reason they failed to pay. It would be a little bit of grace to give them payment that they could hopefully be finished in within a year, and not impact their water. So the city would still get repaid. It just would be a little bit longer.
Chris, to my knowledge, I seem to remember there being some ruling or some language in the end of the proclamation that late fees and other penalties were still not going to be assessed.
That's different. It's if we put somebody on a payment plan, and I think that would be a gift. So a late fee or an additional penalty would be different than the actual service. And so if we give somebody a payment plan to pay the service, we have to charge a reasonable interest rate, whatever that is. Otherwise, I think it'd be perceived as a gift.
Thank you.
But we can waive penalties and things like that. That's a different issue.
What's the total dollar amount on the water bills that are behind? Was it 50,000?
It's a little out of date, but it was over 50,000 at last report.
That's close enough. Thank you.
And obviously that was in August, so we're probably closer to 55, 60. Councilman Scaramucca, did you have something? Does anyone, so again, if you guys have any options, if you have any ideas, send them to Councilman Trimble and me, please, and we will try to craft something, send it over to Finance Committee, and you guys can.
I just have a comment. What we're really looking for is a way to not make things worse for these folks. And so I know you have to explore that question. The more flexible we can be, see if let's take care of is my preference. But I do like the idea of putting out the information about assistance that might be available and helping people to get that, because it may be that there's relief funds available for them. They don't have to have this hanging over their heads.
There is relief funds for them.
Yeah.
I know that. And so, but they have to go through a bunch of steps to get those relief funds, so.
That's an unfortunate reality that a lot of people are not picking up the phone and calling. That the city will be doing the same. Cities across the state and across the county and utilities are doing the same thing. They're letting people know about it, but people still are not picking up the phone and contacting. So if you are behind, I think it's the first step is that you need to contact whatever utility you're talking about, city, and let them know that if you're behind, you have concerns, and that this plan is going to be in place is a good thing.
And so we'll continue to do that. And one of the, kind of going off of Councilman Cope's issue that I think is really important is that we can't do it for them. People have to contact us. And that is obviously a problem if people don't contact us. Because then our only option, and I just want you guys to understand this, our only option would be to cut off the water. And that is consistent with policy and code. We don't get to wait again. So again, finance. This is going to be a big finance month. Next on the agenda is suicide prevention grant.
Yes, and Mayor and Council, I just wanted to recognize one of our firefighter paramedics, Eric Johnson, who applied for the West Region EMS and Trauma Care Council grant. And it's actually for a program that we've never done before in the fire service, or at least here. And so it's a $4,000 grant for suicide prevention and first responders, pilot program. Really excited about it for the simple fact that in law enforcement we have law enforcement and EMS firefighting services, we have a very high suicide rate. And so on the police side right now, we have peer officers, we have critical stress debriefings. We do that on the fire side as well. But it's the peer officers that gives officers, when they deal with a traumatic situation, someone to talk to. And so anyway, he applied for this grant, he received it, and so he's got some work to do to make this program work. But very excited, and I just want to recognize Eric for applying for the grant. So just for information.
We probably need to accept the grant as well, I assume. This is a no match.
It's a no match, and it's actually a reimbursement grant. So as we spend some money, they reimburse us for those funds and so on and so forth. So I don't know, there is actually something here to a reimbursement form, but I don't know if there was something to actually accept it. So I will ask Eric about that.
I move to accept the grant.
Thank you. There is a motion by Councilman Wood and a second by Councilman Bryson to accept the suicide prevention grant. It has a no match and no financial negative impact on the city. Is there any discussion? Hearing none, all those in favor, please say aye.
Aye.
Thank you.
Thank you, Mayor and Council.
Okay, next on the agenda is a structure on fire department. Councilman Carroll has provided some correspondence as well from Montesano volunteer, I lost he's the, thank you, by Scott Booz, sorry. And we can certainly talk about that, but really this was only for purposes of introduction. We're at a point of hiring. There have been some issues on which way to go, and so I needed some level of clarification. What I had asked for is that this goes to the union and to the volunteers for input so they can discuss it, and then it comes back and we can have their information, and also the Public Safety Committee. The reason I asked for this is because I know this council has fixated on public comment, as it should, of having public access to major decisions that impact the city. And this would give the public an ability to also weigh in their opinion, which I think when we make large decisions of any kind, it is a valuable thing that we can do. We assume something, which is the normal course of a belief system, but without input and information and data, it is never challenged. And so what I would ask is that you allow me to, I appreciate Councilman Carroll's materials, but the only step I was asking for is that I be able to contact the union and the volunteers to put this in front of them and to have them discuss it, to send this to Public Safety Committee, to do an outreach towards the community, and then to come back in roughly a month and put that information together and go from there. And so there was no impending doom, there's no impending decision, but it does allow everyone to have a voice, and it allows it not to be perceived as a pre-made decision, which I think has been very harmful and those type of decisions are made behind closed doors. And so I do think that the public's input, and I've never seen the Montesano City not support its fire department, but to see which course it should go is something that we should at least ask and listen, instead of having a kind of a knee-jerk reaction. So Lieutenant Booz has indicated a couple things I'd like to clarify. I have not, and I don't know anyone else that's contacted District 2 to discuss contracted services or merging. And if Mr. Booz will tell me who did that, I will certainly address it, because there's no one in the city that should have done that. And I want to be very clear about that, because this is what rumors do. It tears people apart and tears cities apart. So let's be very clear. I expect Mr. Booz to tell me where he heard that rumor and who he believes did that on behalf of the city, and I will address it with that person, because I don't know what this is about. The second, and I can tell you it wasn't me, and I assume, because the management team hasn't told me, that it's not the management team that would make a decision to discuss contracting services or merging. The next thing is, it apparently, well, I'll leave that alone. The next thing I would say is that I don't know. I just think this is, I was on the council, I don't know when, 97 or whenever it was, when a former mayor made an issue of a request for a merger. I don't necessarily think that's a good idea. I don't necessarily know if it's a bad idea, but I do think that ideas are worth exploring, whether or not it is good or bad. That is not my first, actually it's my third choice. But that's based on just a gut reaction. It's not on my first reaction. The status quo, and I would say there was some quoting of former Chief Rux. I had a conversation with Chief Rux. I don't think he's going to think that I'm out of line in saying this, and I think I can say this also for Chief Vance. Both were very intrigued with the public safety department structure, which is one of the reasons I didn't dismiss it out of hand. So I have two chiefs that have long served the city of Montesano, have supported the city of Montesano and the fire department, and both, they didn't say it was a good idea or a bad idea, but they thought it was worth considering. And so I think that talking to people and hearing people is worth it. And I certainly think that both the union and the volunteers should be part of that conversation, but that should be a conversation and not necessarily a assumption based on bad facts. And so I just guess I wanted to get your direction about the union and providing this information to the union and the volunteers and having those conversations. I guess I do to some degree, yeah.
Well, I would make a motion supporting engaging in discussion with the paid and volunteer staff and fire department. I think it's extremely critical that anytime you're thinking about even discussing the possibility of changing anything, you need to start with people that are doing that work day in, day out. So absolutely I support that, and I'm sure the rest of the council do so as well.
I would second that motion, and which I believe was made, and would say that the most consistent thing that I've heard in talking with members of the volunteers, members of the paid professionals, the administration, is that the lines of communication have been pretty well frayed, and they need to be improved. And having this conversation, it needs to be done in the open. You need to go out and talk to the experts, talk to the professionals that are going to be actually providing these services, and find out what they think is going to work best. Because it says status quo right here. Status quo right now isn't working. The communication lines need to be improved.
Does anyone else have anything else to say? Councilman Wood.
Yeah, I don't favor referring these options to committee. I don't think right now either a long-term combined operation within the city or joining an RFA that hasn't even been created yet are in the city's interests. And so I talked to somebody from the city of Hoquiam to find out where they were with their RFA and their governance and all of that. I looked at the RCW and it says you have to have reasonable proximity. It doesn't say contiguous, so reasonable proximity is not well defined in the RCW, so I suppose someone could argue that you could jump over Fire District 2 to get to Aberdeen. I called a commissioner in Fire District 2 to ask if there had been any discussion between the city and them. I was told no. Last time that happened, I believe, was 2010.
Thank you for affirming that. Thank you for affirming that.
That it was in 2010?
No, that there was no discussion.
Yeah, so I just think this has come out of the blue, and you know, we're taxing people for filling a position that we haven't filled yet at the department. And I think either joining the Regional Fire Authority or a continued hybrid operation, more long-term, I think diverts us from that, and I don't see savings opportunity from either one of those. So I'll be voting no on the motion, and I would prefer that the council instead express its desire that we proceed with hiring a fire department only chief.
Can I clarify the intent of my motion?
Yeah.
Because I really don't think you oppose what I'm getting at, Dan. I'm not suggesting that we enter into discussions about altering the structure. I'm saying we should first and foremost go talk to the fire department, firewomen, you know, everybody involved. And I'm not suggesting I would just refer it to committee. I think we need to start talking to the paid and volunteer staff and say, what do you think we need to do as next steps? Because I think before we have that conversation, we should be having other ones. And once we get that input and we hear back from the public, then I think it's appropriate for us to engage in what we want to do as next steps. But if we do that without including their input, I think it's a pointless conversation. So I'm not, in no way was my motion intended to suggest we explore a merger, look at altering the structure. My motion is simply to talk to the staff.
And I would clarify that my second of that was based on my interpretation of your motion as that too.
But referring it to committee does begin the consideration of these options, and it does delay going out to hire a fire chief.
I would agree. I guess I would say that. I think that is true. But to deal with two of the points that you raised, I think are really valid, and I want to tell you where we are. As I have told you all throughout the summer, I delayed testing until September 1st because I wanted to give an opportunity for those who had been committed to the city to be able to have that option. And that process has been approved by the Civil Service Commission. We're doing testing, I believe, this month, and interviews next month, and it should be dealt with. What you guys may forget is that we had offered a position to someone in April. They declined that, and then we hired a temporary hire. So we kept trying to hire people, and I would agree that after that, it was my choice to delay until September 1st, but I thought that the value that it offered the department for long-term was worth it, and we've had this conversation multiple times. The second part is the issue of fire chief or not a fire chief is valid. It's a valid, it has, I think that Councilman Wood's comment has been the kind of the press on me, which is why I came to you all for direction. And I do think we need to talk about it before if we do this without consideration of what other factors might be at play, I think it's foolish. And I do think that we should have public input. I don't understand why we would not have public input on an issue like this, which is mammoth to the city, when you have demanded public input when we do minor repairs to roads, and where we put stop signs. We have held, and so I appreciate the motion. I think that's the first step. And I think having a conversation about it, but given that where we are, I just wanted to make sure the council was fully aware of the actions I was taking.
I appreciate that. I understand where Councilman Bryson was coming from on that, but I feel that there needs to be emphasized to you the importance of speaking to the fire department and making sure that they understand what it is you're trying to do.
You know, listening, right?
Speaking to them, listening to them, and likewise back to them listening to you.
And
There needs to be those conversations that are going on. I've heard too much about the lack of communication, and I think Chief Vance has done a great job providing some stability back there, but that's the overwhelming the issue that I've heard from that is that there has been some sort of wall that has gone up between administration and the fire department, and that needs to stop.
Well, if any of you would like to join me, at least up to 3, you are welcome to do so. Anybody else?
How long do we expect the discussion in committee to go on before we get back to what we're going to do?
I'm not as worried about the Public Safety Committee. I would be more concerned about the volunteers in the union. I would like to have that opportunity. So first I would ask, I'm a little dismayed at seeing Mr. Booz's letter. It's very confrontational, and that was not the agenda item, which I was very clear about, which is obviously a need for communication, right? And so it is, I would assume, they meet once a month, once every 2 weeks, I can't remember.
Once a month.
Once a month. And so I would ask to be put on their agenda for the next month, and then we would go from there, based on what they say.
May I speak to this real quick?
Of course.
I think a lot of the problem and the reason you're getting this communication from Mr. Booz, and that we have a number of firefighters here today, is because they felt ambushed by this agenda item. There was no pre-communication, no nothing. No one was aware this was even being discussed, and suddenly it's an agenda item. And maybe it was misunderstood, but if there'd been some kind of precursor to it coming out in the agenda, it would have been much easier to swallow and to understand.
So communication is a two-way street, and I know I've contacted Mr. Booz in the past. It is unfortunate that you provided the letter today instead of him contacting. I met with him over the summer. I met with him a month and a half ago. And so I appreciate what you're saying. I don't know why anybody is, I know I met with him. And so if he had questions, it's unfortunate he thinks that the relationship is such that he can't call me, because I certainly felt comfortable to call him. And I believe we talked for over an hour about the same issues that we're talking about. And so,
I'm sorry.
it's okay, sorry.
I just want to make a comment. There's no reason we can't start having those conversations. I believe that everybody involved is capable of doing that, and that's what I think needs to happen next. So, rather than litigating the past, I think we need to go to the fire department, have this conversation.
So I'm just trying to find out how long there will be discussions about restructuring until a decision is made that will either lead or not lead to hiring a fire chief.
So I will, as soon as I meet with them, I will bring back to the council, tell them their position, and then you guys can decide whether or not you want public comment on this issue. And if you don't want public comment or public access to have any information on it, then that's your decision. And then we'll go from there. So I don't know, because I don't know when the next meeting is. I don't know if Mr. Booz will allow me to appear to talk to him. I assume he will, but, but I don't know what their agenda is. I can't assume that. Yes, Mr. Pratt.
How about some public comment right now?
Well, we're not there yet. So there will be public comment. There will be public comment. So, Councilman Carroll, since you're part of the volunteers, when is the next meeting?
It'll be the second Monday of October.
So I would assume the second Tuesday of October would be your report.
Okay, thank you.
Any further questions or discussion? Okay, hearing none. All those in favor?
Aye.
Any opposed?
No.
Motion carries. Moving on to ordinances and resolutions. This is a resolution authorizing a program of public safety emergency response cost recovery in relation to fire protection, emergency medical services, and related services. There have been two elements that were negotiated. I'll let the chief talk about it.
So this is the resolution's already in place. The council did it back, and I can't remember what the year was, like 2014 maybe? And this is just an updated contract. I think with the mass exodus of our senior staff, I think we haven't used this program, but this is just a new contract that updates it. I went through Mr. Coker, and we had two items that were adjusted to it. Mayor, did you get the new addendum, which then allows us to get out in 90 days, and so we're not locked into it for a year, as well as moving it to Grays Harbor County for any resolution. So it's not a cost to the city. All it can do is benefit us in recovery from of incidents that we go to. So it would just be on us if we utilize it.
So just so that you guys understand, the only two contractual changes is a 90-day escape clause for the city, and I guess assuming the other side, and the other part of it is that the conflict resolution will be in Grays Harbor and not in Pierce County.
Yes, that is correct.
You looking for action tonight?
Yeah, I'm.
Are we looking to reaffirm the current resolution?
I think.
What's that?
Are we looking to reaffirm the current resolution?
I don't know if we need to. The resolution was put in place, so it's a funding. It's a
contract.
Yeah.
So we're authorizing the mayor to sign an updated contract.
Second.
Wait. Thank you. Okay. I'm going to take that motion for resolution number 980 from Councilman Bryson, a resolution authorizing a program of public safety emergency response cost recovery in relation to fire protection, emergency medical services, and related services, and seconded by Councilman Wood, with two changes which are not in front of you. One is the conflict resolution to be in Grays Harbor County and a 90-day termination clause. We don't have those addendums, but we will get those. Is there any discussion?
I have a question.
Yes.
Their charge is a percent of what they recover? Is that how they're?
They do. This is a recovery program that we've already used, and basically for accidents, fires, hazmat stuff, we go out, we do these things. Insurance companies pay for this stuff. We can actually submit this to this company. They will get us reimbursement fees. They take a percentage of it. So
What percent was it, 20?
what's that?
Did it have the percent in there? Or what?
I don't have that. I apologize.
Okay.
I don't remember.
But it's funds that we don't recoup right now. So,
Right.
and I don't think it's actually a percentage. I apologize. I believe it's actually, there's a set scale.
There was a fee
It's
that.
22%.
22%? Yeah, okay, that's what
But these are funds that were not otherwise recovered.
Right.
It's a collection agency.
Yeah, I was gonna say back in the
Right.
days we called them bill collectors, I guess. All right.
Anyone else have any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Motion carries.
Thank you, Councilor Mayor.
So now we are at public comment. If anybody would like to make public comment at this time?
You know what? I should.
I'm going to have you come to just for the camera and I believe that's Mr. Pratt.
This is Steve Pratt.
Thank you.
15-year resident in Montesano. About 32 years in EMS and fire service. I've got one question for the council and mayor, or a couple probably, by the time I figure it out. But the first question would be, you guys are collecting EMS funds, a rate went up and the city has not hired the 6th position, and we wonder why. So you got roughly about $200,000, $7 per resident, sitting in a fund somewhere, and you haven't done anything with it. So what's your goal? When are you going to hire somebody? And now you want to hire assistant chief? We don't need an assistant chief. You need a chief. And then one more person doing the job to help the other 5 people. That's what you need. So my question would be to the council and to the mayor, when are you going to hire somebody? Fill that position that you've already collected money for. I'd like to know, as a resident and a volunteer.
Thank you.
All right.
Is there anyone else that would like to make public comment at this time?
My name's Jordan Bazard.
I'm so sorry, could you repeat that?
Jordan Bazard. I've lived in Monty my whole life. I'm 25 now. I'm also a career in fire EMS. I'm based out of Shelton. So kind of just to piggyback his, all the way from 1970s in this department, we've always had 5 firefighter paramedics. Since April, our daytime guy has went to 24, and we've been out a daytime guy for the last 7 months, which has never been like that. We have a temp filling that spot, but it's not a medic, so they can't run more than one ALS call. And our other guys are just getting pounded in the ground with no hiring. We're talking about the 6th position, but we don't have a fifth position hired yet, which is our normal. So I guess I'm just a little confused. We're worried about a 6th position, but we don't have a 5th one done yet. And I don't think an assistant chief is what we need. We need more line people. That 6th position, I was told, was going to do a 24 hours, 7 days a week. And that was laid out by a different councilman years when they talked about raising the water or utility rate. But that's all.
Thank you. Does anybody else like to make public comment at this time? Okay, moving then to council comments. Let's start with Councilman Carroll.
Madam Mayor, would it be too late to propose another motion in regards to this topic?
Which topic?
The fire department reorganization issue and meeting with the volunteers and the paid staff.
I don't think so.
Okay, what I'd like to propose is that we invite them to come 6 o'clock at our last meeting in September and have a public forum at that time.
So I would ask for the first, I would like to give the public notice as well.
Absolutely.
So the best way for us to do that is not usually by notice in the newspaper. So if you would do that on the first meeting of October, I could put it in the newsletter, and that would allow public, because there's no other, we could do Facebook. Traditionally, what we do is Facebook and the newsletter, because that accesses every single household in the city. So if we did it on the second meeting of September, that's not going to be possible.
I'm just trying to think of ways that we could expedite this a little bit.
So the question is, can we do the 6 o'clock for the volunteers and the union, but it wouldn't be for the public, because you're not going to give them you're not going to have any way to give them notice.
Could we just carve some time out on the regular council time?
So I'm not just, okay, so we're doing two different things. I don't think there's anything wrong with doing the 6 o'clock thing. I'm just saying that if the goal is to give public notice, that's not going to be fulfilled. If the goal is to invite the union and the volunteers to come and talk about it, we can certainly do that.
What, Councilman Carl, how would you feel about starting there and then following with the notified public meeting following?
I trying to look for options here to get some movement, because I know there's a lot of issues with the fire department staff, and I would love to see us resolve some of those as expeditiously as possible. And I think as this becomes public, there's going to be a lot of public sentiment also that needs to be heard about it. I guess I'm just looking for a way to motivate us to get that taken care of as quickly as possible. The whole package, starting with a little bit of it with the fire department is great, but we also, you're absolutely correct that the public needs to be involved in this discussion also.
But having the public involved in the discussion means that they have to know that the discussion is happening.
Absolutely.
And the only way, we have 4 ways of making that happen. The newspaper, a notice, a legal notice, which we wouldn't normally do in this situation, the newsletter, and Facebook.
And radio.
What? And radio. Sorry. Radio. And so thank you. So I don't. What's that? Without we've been using the newsletter as our medium to communicate since it goes into every household. And so between Facebook, the radio, and the newsletter, it usually covers every option we have to make sure people know what's going on. And it gives them an opportunity to email us, write whatever they want. And I would just suggest that maybe I understand there's an incentive, but I don't think that the 2-week delay will create more harm than not.
For purposes of this discussion, will you remind me when the meeting was discussed at the fire hall will take place? Is that the second Monday of October?
It's the second Monday of October. Now,
so we would be scheduled to meet second Tuesday, the 12th. So I personally think it's appropriate to have that conversation with the fire department first, and then bring them into the public and give the fire department an opportunity to participate in that public meeting as well. So just food for thought. It's your motion, but just a suggestion.
I'll withdraw that motion and with the presumption that we'll do something on the meet with the.
So instead of withdrawing it completely, perhaps you could amend it to doing it on the first meeting of October.
If that would work.
Second.
There is a motion and a second to have a town hall at 6 p.m. on the first meeting of October to have public commentary on the future of the fire department. I'll leave it at that so that we can kind of leave it vague. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? Motion carries. Would you like to comment on anything else, Councilman?
No, I'm fine, thank you.
Okay. Councilman Scaramucca?
Is firefighter Eric Johnson here tonight, or?
He's not here tonight.
Oh, well, I'd like to say personally thanks. That's cool. That's neat. Thank you. And that's it.
Councilman Bryson?
All right. A lot of good discussion tonight. I just want to make it very clear that just because we're discussing what needs to happen with the fire department, there's no movement or changing what the fire department's been structured. It's we should always explore things, just keep an open mind, have discussion, but that hasn't even been broached, so thank you.
Councilman Cope?
I think I've said most of what I'm feeling already, but I just want to send congratulations to one of our own, to her honor, Judge Megan Valentine. Very, very great moment for the county, and a very proud moment for this council to see one of our own elevated to the bench. So congratulations to her.
Who's next? Who's next to go from the council to the bench? Huh?
Councilman Wood?
I also want to thank our Eric for doing the grant for the suicide prevention. I know that is unfortunately becoming an increasingly important thing in so many communities and so many professions, and it's good to have resources in place for people who have those struggles, and and to try to take the stigma away from that. And so awareness and prevention are very key on that. Mr. Pratt brought up a concern that I have, that we are taxing households for filling a position or positions at the fire department, and we haven't done that. The reason I voted against the motion on sending the options from the mayor to committee is because I think the first one with the regional fire authority is, I think it's premature and out of place. Aberdeen and Hoquiam haven't even formed their regional fire authority. They'll be voting on that in November. But they already have a governance plan that would have, of their 3 voting members on their board, 1 would be elected by the citizens of Hoquiam, 1 by Aberdeen, and 1 at large between the 2 cities. I don't foresee a governance option for Montesano having even a vote on that board. They've got a plan for turning their buildings, their ambulances, their trucks, even down to their chairs, over to the regional fire authority, I believe after Aberdeen builds a new station. They don't have a volunteer structure. I have a hard time conceiving how our career staff and volunteer structure would fit in to their rubric. And I just, I don't believe it's reasonable proximity that's required by the law. And I don't conceive in any imaginative way that having folks in Aberdeen and Hoquiam run our fire department benefits us with savings or better operation. In terms of, I thought having Chief Vance run both departments was a temporary thing. I don't think that, I think that is too much of a burden on one person. I credit Chief Vance for the work he's doing. I've heard good things from our staff, but I think long-term that is not sustainable. And the proposal that was in our agenda said that that would involve hiring an assistant chief, which I don't think is going to be a significant savings in salary and benefit, an assistant fire chief. And then secondly, that would mean that we wouldn't do that either senior captain or some other position. So we would basically be looking at something where we've had discussions about a position covered by the bargaining agreement suddenly would no longer exist in that plan. So I don't think it behooves us to spend time considering either one of those. So it is my hope that we can quickly dispatch with these ideas and move on with hiring a standalone fire chief for our fire department.
Councilwoman.
I would quickly like to thank the hospital and the commissioners for their presentation tonight. It was informative. And I would like to extend on something that Dr. Anne-Marie Wong, the Chief Medical Officer, stated tonight about healthcare workers being overtaxed and burnt out. And I would like to add to that group the overburdened and to the healthcare worker group, the fire department and the police departments, because they are all part of the public health safety group. We all work collaboratively to maintain the health and safety of the community, and everybody right now is overworked and understaffed right now, everybody in the community. As we try to manage the patients and try to find placement for them, it's kind of this challenge of who's got open beds, and the paramedics who are picking them up are, I don't work for the fire department, but when I go to the hospital, I see this and I see that they're on the phone trying to find placement for them. And the hospitals are full and there's not enough staff, and it's a challenge for everybody. So I just wanted to also acknowledge those groups of personnel as well.
Thank you. So I did want to answer the questions that Mr. Pratt raised, because I think that's a valuable thing that needs to be addressed and important. The first thing is, we are not going to collect $200,000 for the EMS fees. Ideally, we're collecting around $150,000. We have collected so far roughly $87,000 for the year. The question as to why the sixth position has not been hired, we advertised in November. We advertised, this is before the sixth position, we advertised again in, I believe, December or January. We advertised again and did testing in March, April. There were 3 or 4 positions, I can't remember off the top of my head, of people, 3 or 4 applicants that tested. Only one exceeded, they passed, I guess, I'm not sure if I'm using the right terminology. That person was offered a job, that person declined the job. So the next question in the month of May is, should we go out again for testing in the month of May or June? So, and that was when we hired the temporary hire. And so I want to be super clear, because this allegation continues to come up, that we're not trying to hire somebody. I remember at least 3 tests or 3 processes between November and April, through April, and multiple job offers being offered to those applicants. I can't control whether or not they accept that offer. But in the month of May and in the month of June, I would agree with you that it was my choice not to do further testing. And I've explained the reasons why, so I won't reiterate it. But let's be completely clear that activity has been happening. Perhaps not the ideal result, but activity has. If you want to ask me more questions about it, I'm happy to talk to you after the meeting. The second thing you raised was the issue, I think actually Mr. Boussard asked this, is why firefighter versus assistant chief. And then also there was a statement of a 24-hour position or whatever. So we are in a place, and this is kind of comes back to what Councilman Wood was talking about a little bit. We're in a place, a unique place that probably will not occur again for, I don't know, whatever, where everything was in flux. And so when things were in flux, ideas percolated as to where is the direction, but there was no input from anybody. And so I've never come from a school of thought that good ideas won't survive a vigorous debate. There should be no reason under the sun, if what we need is a fire chief position, that issue couldn't be debated. It doesn't even make any sense to me that a good idea is undefensible. I live in a universe where we debate, we have good discussion, and we make the best decision possible. That is not, that is the way good government should work. When you cannot debate an idea because you have such strong opinions, that's when failure starts. Because we don't look at options and decide. A perfectly good decision would be, we're going to stay with the position that we have because it's the best position for the city. But I think that council and the mayor have, and I think all of you have a responsibility to have that debate once in a while. It is, and that is not anti-fire department. That is pro-Montesano. And I don't understand why the assumption that having a debate or a discussion, really more than anything else, is something that is negative to all of us. And I would say that when I come here, if anybody had actually read the agenda item, and I do say that, if you looked under the comments, it said very clearly, suggestion is that it goes to committee and that we get the union and volunteer input as to each option's pros and cons. It didn't say we're making a decision. It didn't say pick this one. And in each one of these, it identified a timeline. So while there was statements about Hoquiam and whatever, the reality is if, the Regional Fire Authority would take 2 to 3 years. And that should have been read all the way through. Bad decisions come from people whose minds can't evaluate their position, whether it's in business, whether it's on annexations, whether or not it's on this issue. And that's, that's certainly a choice. But discussion doesn't hurt anything if an idea is a good idea, and if it's a good idea for the city, which is what I would expect out of anybody that is focused on doing the best that we can for the city of Montesano, which is really what we need to do. So I appreciate the motion, and I'm hoping that we can have a conversation, as Councilman Cope said, and that everybody can listen to each other, and then we can move forward and make a good, solid decision, because an assessment of whether what we're doing is good is valuable. I think that Mr. Booz said that we did it in 2002. It's 20 years later. Let's make that assessment again. Nothing wrong with that. And so with that, I think I'd be entertaining a motion.
Move to adjourn.
Second.
There's a motion and a second. Any discussion? Hearing none. All those in favor, please say aye.
Aye.
Councilman Carroll, do you have an extra copy for motion passes? Do you have an extra copy for the record?
No, barely use it. I don't write much down. Okay, Vinny. I'll call you. See you later. Have a good night. See you guys.
Thanks. Well, it's not informational when you present it to me today in the meeting and you give it to the council. If you have that letter and you want to put it in the packet, or if you want to present it to everybody, it should be for the public record. And now it will be. But I don't, surprises never make good decisions.